Hello everyone, once again welcome to my IT channel. Today I came with one role play card. This is today's exam role play card, and actually this question came during 2023 in the starting time, the starting months and all. So nowadays they have repeated question, so you can just go through this 2001, 2 and 3 cards and all, and you can have a quick look, so that maybe if you have a luck you will get the same card. Okay, so the scenario is dermatology clinic, and our role is you see a 28 years old patient who has athlete's foot, it is tinea pedis. You suggest possible causes and advice on self-care. So this is the overall scenario, and you are talking to a athlete, but you have to make sure that he is a athlete. Okay, then only the conversation will be goes in a flow. So the first task is find out reason for the visit. So we can start like this. Good morning. My name is Reshmi Rajan. I am one of the registered nurses working in this dermatology clinic. May I know your name and how can I help you today? So the answer will be, good morning sister. My name is Matthews. And actually I came here with some issues in my foot. So I just want to get some medical advice. So the answer will be, oh, Mr. Williams, no need to worry. I'm here to help you. So before proceeding further, may I ask you some questions? Okay, so our next question is reassure. So that is a reassurance what we gave now. Reassure athletes' foot. Example, common and treatable condition, contagious fungal infection seen in athletes, prevented by good hygiene and food care. Then the next subtask is fungal thrive in warm, moist environments like pools, showers, locker rooms, and other sports facilities. Find out his or her relevant details of the condition. So this much you have to answer here. But here actually they have started with the reassurance and the condition. We didn't examine the patient. So just we can do like this. Before proceeding further, may I have a quick examination of your feet? Like that you can ask. Then you can continue. Thank you for allowing me to do that. Actually, no need to worry. I want to ask you that, are you an athlete or where you are working? So the answer will be, yes, sister, actually I am an athlete and I am a professional swimmer. Okay, so we can continue with that. Actually, from my observation, what I can tell you that it is athlete's foot, and medically we will call it as like tinea pedis. It is a common condition and it's a treatable also, but it is a contagious fungal infection. We can see in many athletes, but we can prevent it by good hygiene and food care. Are you getting my point? Then we can continue with that. For your further information, I would like to explain you. Actually, this fungi will thrive in warm, moist environment such as pools, showers, locker room, and other sports facilities where we will use the space as a common. Could you please tell me, do you have any relevance to these points? So that is the thing. Okay, like this only we have to ask, find out his or her relevant detail of the condition. Means what are the things we explained. We are asking them, do you have any of these factors, like whether he's using the common pool, showers, common locker room, any other sports facilities like commonly some people share. So the answer will be, yes, sister. Actually, as I told you, as I am a swimmer, so I am using a common pool, and I'm using the locker rooms, the common locker rooms and all. So the answer will be, okay, thank you for your information. Our next task is mention symptoms of athlete's foot like blisters, cracking, peeling, and dryness of the skin, affect toenail, make them thick, crumbly, and discolored. Fungal infection is hard to find out the origin. So we can tell that. Mr. Williams, actually I would like to tell you regarding athlete's foot symptoms. So sometimes you may experience some blisters over your feet area, cracking and peeling, dryness of the skin, and sometimes it can affect the toenail also and make them thick, crumbly, and discolored. So no need to worry. These all are signs and symptoms of this fungal infection. Actually, we could not find out the origin from where it started, because it will spread from one area to another area very quickly if untreated. But no need to worry. Anyway, you are in the correct place, so we will help you. No need to worry about that. The next thing we can ask, do you have any concern about your condition? Any specific concern? So the question will be in between you can ask, okay? In between you can ask, do you have any concern? Because it should not be a monologue, it should be a dialogue. So both parties should have equally engaged in the conversation. So the question will be, a sister, actually I want to know about the treatment. How can I get rid from this condition? So our next task is actually treatment option. We can tell like that, okay? I will explain you in detail. We can actually there are antifungal creams, powders or spray. Even oral antifungal medications are also available according to the symptoms. Along with the medication, please maintain proper hygiene like a clean and dry feet. You can use breathable shoes and socks and all. So with these all management criteria, you can get rid from this your condition. So how does that sound? Like that we can ask. And our next task is tell him or her to stop swimming until recovery, possibly contracted from pool area. We can tell, for your further information, I would like to advise to stop swimming until your complete recovery, because the pool areas are there will be more contaminated. So if you keep on swimming, and your problem can be aggravated. I'm sorry to tell you about this, but it is mandatory for you to stop swimming temporarily. So are you okay with that? Like that we can ask the question. Discuss the possibility of recurrence, like incomplete treatment, infection, underlying health condition, poor hygiene. We can maybe either you can ask, do you have any more concern? So the patient question will be, it's very hard for me to stop swimming, and but if there is any recurrence will happen. So what about the effectiveness of the treatment? Like that maybe the person can ask. So your answer will be, I would like to explain you regarding the possibility of recurrence if your treatment is incomplete, or if you're getting multiple infections, or if you have any underlying health condition, and if you are maintaining poor hygiene, there is such great chance for recurrence. Like that we can tell. And explain the importance of continuing management. So we have to tell that, Mr. Williams, I would suggest you to continue the management, such as to prevent further atlas foot. So the task is recommend some strategies. Okay, so that I would like to give you some strategies. Please wash and dry your feet and between toes daily. And it is essential for you to wear well-fitted shoes with the air circulation. Please change your socks frequently. Moreover, you can use antifungal powder if needed. Do you think you can do that? Like that you can ask. And the subtask is suggest ideas when in public. So you can tell that one more thing I would like to add you, that when you are in public, please try to avoid walking with the barefoot, and try to avoid sharing towels, shoes or socks. So it is very much mandatory to follow all these measures. I hope you can follow that, isn't it? Like that we can ask. Then the last question will be, do you have any more concern? The answer will be, no sister, I don't have any more concern, thank you. So our conclusion is, Mr. Williams, once again I'm reassuring you that with all these measures your problem can be resolved. Please try to follow my advices. And meanwhile, if you need any help, please do not hesitate to contact with us. This is our contact number. I hope I have clarified all your doubts, and I wish you a speedy recovery. Thank you for your visit. So with this we can wind up the scenario.